Welcome to 2025 Open Enrollment. This presentation will provide an overview of what you need to learn and do so that you can enroll in benefits for next year. We'll cover benefits for 2025, a closer look at the flexible spending accounts and how they work, steps to enroll, and resources to help you learn more. Open enrollment for 2025 benefits will be held November 6th through 20th. This is your opportunity to enroll in benefits for next year. The benefits you select during open enrollment will be effective from January 1st through December 31st of 2025. Once enrollment ends, you can only change your benefits during the year if you experience what we call a qualifying life event. Things like getting married or divorced, having a new baby, adopting a child. Those would be opportunities to make changes that align with whatever life change that your family has experienced. Outside of those changes, the benefits that you select will be in place for the full calendar year. Now, you must take action and enroll if you want to have medical coverage in 2025. Your current medical coverage will not carry forward. This means if you don't enroll, you will not have medical coverage beginning January 1st. You also must enroll if you want to participate in a flexible spending account or the vacation and PTO cash-out program. A quick review of who's eligible for our healthcare program. So benefit earning employees working 20 or more hours a week can participate in open enrollment. You may enroll in healthcare coverage for yourself, your spouse, and your dependent children ages 25 or younger, including stepchildren and dependent grandchildren. If you have any disabled children who are ages 26 or older, they may also be eligible for coverage, but they do need to meet certain qualifications. Now, if you're adding a new dependent to your coverage for next year, keep in mind that you are required to submit documentation in Apex verifying their eligibility before you enroll them. You can find a list of required documents out on the eligibility page on the bridge. Each year, Hennepin County takes a close look at our benefits package to make sure that the dollars we spend are invested in meaningful programs. Let's take a closer look at some updates and highlights for next year. In 2025, Hennepin County will continue to offer a single health plan to employees. This plan continues to be administered by UMR for medical coverage and OptumRx for pharmacy. You continue to have flexibility and choice in the providers you can see through the National United Healthcare Choice Plus network. In 2025, the plan will have new deductible amounts of $500 per individual up to a $1,000 maximum per family. You also continue to have low copays. Office visits are $20, and if you've earned the health incentive, your office visit copays are $0. Keep in mind, you must meet the plan's deductible before your copays begin. Lastly, prescriptions continue to be available for a copay. They are not subject to the deductible. Beginning in 2025, all prescriptions will cost one copay per 30-day supply. If you fill a 90-day supply, even through mail order, you will pay 3 copays. The copay discount on a 90-day prescription through mail order is no longer available. The county's health plan is self-insured, which means the plan pays the cost of services every time you receive care. Hennepin County pays nearly 90% of the plan's costs. The remainder is shared with you through premiums and out-of-pocket expenses. In 2025, total plan costs are estimated at nearly $200 million, of which the county will pay approximately $174 million. The table on this slide shows the healthcare premium cost per paycheck for you and the county. Costs are based on the coverage level you select. For 2025, there are no changes to dental or vision coverage. Both programs continue to offer a single plan. The dental plan continues to be administered by Health Partners, and the vision plan is insured by IMED. Coverage for both plans remains the same for 2025, and there are no increases to premiums for the 5th year in a row. Here are the costs per paycheck for dental and vision coverage. These costs for 2025 are the same as in 2024. The dental plan on the left has two coverage levels. If you are a union member and have access to a dental plan through your union, your employee costs for the county dental plan will be higher. Costs for vision coverage are reflected in the table on the right. Next is a reminder about the health incentive. When you earn the health incentive for 2025, you receive a $20 discount off your office visit copays for next year. For the 2025 health incentive, your last date to earn and track points is October 31st. Beginning November 1st, you can start earning and tracking points for 2026. As a reminder, if you cover your spouse on the health plan, both you and your spouse must each earn 3,000 points to receive the family health incentive. To check your health incentive status, to track points, and to find more details, log into the LiveWell portal at umr.com. Once you're logged into umr.com, select the LiveWell tile at the bottom of the screen. The Vacation and PTO Cash Out Program will again be available in 2025. You will be able to cash out up to 50 hours of vacation or PTO. To be eligible, you must meet 3 criteria. First, you must choose how many hours of PTO or vacation you want to cash out during open enrollment. Then, you must earn the hours in 2025. Hours you earn in prior years are not eligible for cash out. In addition, if you are close to the maximum PTO or vacation accrual limit, you must reduce your balance to allow you time to accrue hours in 2025. And lastly, just a reminder that the PTO cash out happens at the peak of summer vacation time. Be sure you have enough hours in your PTO or vacation balance on July 25th to cover your cash out. No partial cash out payments can be made. The cash out payment will be made on August 1st, 2025, and is based on your rate of pay at the time of the cash out. There are also some updates to the flexible spending account contribution limits. We'll next look at those updates and discuss FSAs in a little more detail to help you understand more about how they work and how you can use them to save money. If you're not familiar with a flexible spending account, or an FSA, these are accounts that allow you to set aside money pre-tax from your paycheck to be used for specific expenses. Here at Hennepin County, we have 4 types of FSAs: a healthcare FSA, a dependent care FSA, an adoption FSA, and a parking FSA. You must enroll in the FSAs each year if you want to participate. Let's take a closer look at these accounts, starting with the healthcare FSA. The healthcare FSA can be used on healthcare-related expenses, like your medical, dental, or vision expenses. This includes costs like deductibles, copays, braces, eyeglasses, over-the-counter medications, and more. In 2025, the healthcare FSA annual contribution maximum is increasing to $3,200. The 2024 carryover limit is increasing to $640. This means if you're currently participating in the healthcare FSA, if you have any remaining funds in your account at the end of 2024, up to $640 will roll over to next year. Any balance you have at the end of the year over $640 will be forfeited. And then that last column in this table on the right references a grace period. The healthcare FSA does not have a grace period. Your expenses must be incurred by December 31st to be eligible for reimbursement. The next FSA is a dependent care FSA. It's intended to be used on expenses that you incur to care for your dependents while you are at work. This includes costs associated with daycare, before and/or after school care, and elder care. It's important to note that dependent care FSA cannot be used on healthcare-related expenses. If you have healthcare expenses for one of your dependents, you must use healthcare FSA funds to pay for those healthcare-related expenses. For the Dependent Care FSA, the annual contribution limit remains at $5,000. This account does not allow a carryover, so you do need to plan carefully. However, you do have a grace period, which allows you to incur expenses past the end of the year, all the way through March 15th. This means if you're currently enrolled in the Dependent Care FSA, you can use your 2024 funds on dependent care expenses through March 15th of 2025. And if you enroll in the Dependent Care FSA for 2025, you have until March 15th, 2026 to incur eligible expenses. The next FSA is the Adoption FSA. It can be used on expenses that you incur through the process of adoption. This includes costs such as attorney fees, court costs, counseling fees, travel fees, and more. The annual contribution limit for the Adoption FSA is increasing to $16,810. This account does not allow a carryover. It is a use it or lose it account, so any money left over at the end of the year is forfeit. However, you do have a grace period, which allows you to incur expenses through March 15th. Before signing up for the Adoption FSA, we recommend you consult with a financial advisor to ensure you are optimizing your participation in this account. Adoptions can be lengthy processes, and the use it or lose it rule still applies, even if your adoption extends across plan years. So please plan carefully. And lastly, the Parking FSA can be used on parking-related expenses that you incur while you are at work. This includes costs such as parking meters and ramps. The Parking FSA works a little different from the other accounts. Instead of an annual contribution, it has a monthly contribution limit of $315 per month. The money in your Parking FSA does not expire. However, you only have 180 days to submit an expense for reimbursement. In addition, the Parking FSA does have some flexibility. If your parking costs change during the year, you can adjust your contributions as needed. When you use an FSA, the money goes into your account pre-tax, which can add up to big savings. Here are a couple simple examples that show the tax savings power of the FSAs. So first we'll look at the healthcare FSA. If you incur $1,000 in healthcare related expenses, maybe it's the cost of your family deductible. When you use your FSA, remember you haven't paid taxes on that money, so your total cost is $1,000. If you were to pay that same $1,000 from your personal savings account, you would be paying after taxes. In this example, we're using a 30% tax rate, which equals about $300 in taxes. So your total cost would be $1,300. Keep in mind your tax costs will vary depending on your personal tax rate. But you can see in this example, using the healthcare FSA saves about $300 that this employee otherwise would have spent in taxes. The next example takes a closer look at the dependent care FSA. For those of you who have dependent care needs, you know how easy it is to spend $5,000 a year in daycare expenses. If you were to pay $5,000 using your FSA, you're using pre-tax dollars to pay those expenses. If you were to use money from your personal savings account, you would be paying after taxes. In this example, that would equal about $1,500 in taxes, so your total cost would be $6,500. And if your child has daycare costs for 10 years, that equates to about $15,000 in savings that you otherwise would have paid in taxes. So you can see how those small savings can really add up. The last thing we'll touch on about FSAs is how easy they are to use. First, you must sign up during open enrollment each year. When you do, your contribution is automatically deducted from your pay in equal amounts throughout the year. Then simply use your money. You have 3 ways to do this. First, you can use your P&A debit card to pay for eligible expenses. If you don't have a card already, one will be mailed to you after you enroll. This card can be used at the point of sale simply by swiping it at the register. You can use the card to pay invoices. You can even connect it to an app such as a parking ramp app and have the payment automatically deducted from your debit card. If you enroll in multiple FSAs, you can use the single debit card for any of your eligible expenses. The system is smart enough it will automatically deduct your funds from your applicable account. If you choose to pay out of pocket for an expense, you can use the P&A Group app from your phone to take a photo of your receipt and then upload it and submit it for reimbursement. And you can set it up so that the money is deposited directly into your bank account. And then last, you always have the option to use the reimbursement form on the P&A Group website. You can fill it out and submit it electronically or mail it directly to them. So let's take a look at the steps to enroll. Open enrollment again is November 6th through 20th. This is your time to take action. Remember, enrollment is required. If you don't enroll, you will not have medical coverage next year. So to enroll, first, take some time to learn about your benefits. There's a lot of resources, including enrollment information, a benefits guide, link to provider lookup tools, and more out on the bridge at bridge.hennepin.us/open-enrollment. Next, if you are adding a new dependent to your coverage for next year, make sure you upload the required verification documents into Apex. Once you do so, you'll receive an email from HR after those documents have been confirmed. If you do not provide the required documents, your dependent will not have coverage in January. Then, when you're ready to enroll, log into Apex between November 6th and 20th. Select the open enrollment tile and follow the enrollment steps to choose your benefits for 2025. When you are done selecting your benefits, be sure you submit your benefit elections or your enrollment will not be processed. The Submit button is in the upper right corner in blue. After you've submitted your benefit elections, you can immediately review your confirmation statement in the final step. You will also receive a link to your confirmation statement the day after you submit your elections. Please open and review your confirmation statement carefully to confirm it accurately reflects the benefits you want for 2025. Be sure you have the medical, dental, and vision coverage you want. Check to confirm you have enrolled your dependents in the correct coverage and verify that you didn't unintentionally waive coverage. If you need to make changes, you may return to the open enrollment tile in Apex to resubmit your 2025 benefits. Any changes must be submitted by November 20th. We hear the question a lot, how do I know I'm done? Well, you can confirm this with 3 simple steps. First, be sure that you click the Submit button. Then, check that your enrollment status indicates submitted. And last, the day after you submit your enrollment, watch for an email with a link to your confirmation statement. If you didn't complete all 3 of these actions, return to the enrollment site in Apex to finish your enrollment. This concludes the overview of 2025 open enrollment. Thank you for your time. If you have additional questions, visit the bridge for more information or reach out to our HR Service Center at hr.servicecenter@hennepin.us or call 612-348-7855. Thank you.